Hi everyone, it's Sarah from Hearth and Home Midwifery, and today I'm going to be talking about 3 ways that you can prevent and treat gestational diabetes. So gestational diabetes is diabetes of pregnancy. It's diabetes during gestation, and it occurs in about every 9 out of 100 pregnancies. And sometimes there are strong contributing genetic factors and things that are really outside of people's control. But very often there are things that you can do, even with an increased risk, to prevent gestational diabetes or to treat it once you have it. So I'm going to be going over the top 3 ways to think about it today. The first way to prevent gestational diabetes is to limit dietary sugar. This is a broken record for most people who live in the United States. It's really well understood that limiting dietary sugar will put less of an impact on your pancreas. It will require less insulin released by your pancreas and just overall lower your blood sugar. But it can be really hard just to hear limit your dietary sugar. So the way that we like to think about it in our practice is, instead of thinking about all of the dietary sugar foods that you can't have, think about all the foods that you can have. So what are the protein-rich foods that you really enjoy? What are the fat-rich foods that you really enjoy? Think of all the butter, the avocados, the fish, the red meat, different oils, things like that you can enjoy in your pregnancy, and approach grocery shopping from that point of view. So really stocking up on protein and on fat, and then just lowering the amount of sugar that you are purchasing, the amount of, in particular, simple carbohydrates that you're purchasing. And that can be a more successful way of thinking about blood sugar, rather than just focusing on limitation, focusing on everything that you get to enjoy. The second thing that you can do to prevent gestational diabetes is supplement with vitamin D. So there have been a number of studies that demonstrated really well that vitamin D supplementation in first and second trimester can lower the risk of gestational diabetes. So we really recommend getting your vitamin D levels checked before becoming pregnant. If you're thinking of becoming pregnant, in our practice, we offer a vitamin D check at the first lab draw that we do, which is usually at people's first prenatal appointment. And then we make recommendations based on vitamin D levels. You may be in a region where you can actually get sufficient vitamin D just from being outside and from your body synthesizing it from the sun. But we live in the Pacific Northwest at Hearth and Home, and so we're in Oregon and Washington, and very, very few people in our region are able to get enough vitamin D just from being outside. So usually a supplement is needed, and individual supplementation recommendations can be based on your lab values, but it's very clear that sufficient vitamin D levels in the blood can be preventative for gestational diabetes before and during pregnancy. All right, and the third thing is regular movement. So it's great to exercise. We all know that, but let's talk a little bit about why it's good to exercise in terms of gestational diabetes. So when we exercise, our muscles use glucose, and so the glucose that we're ingesting isn't in the bloodstream anymore. It's being used by our muscles. So that overall makes the job of the pancreas easier. It means that less insulin needs to be used because the body is actually using the glucose that's present. So it just means that basically, rather than taking in sugar and then not using it, we're taking in sugar and then using it. So it means that our overall circulating glucose over time is lower. So it's very clearly shown in the evidence, as well as in people's anecdotal experience, that using their muscles, getting their heart pumping, getting regular movement can lower circulating blood glucose. And the really encouraging thing about gestational diabetes is that even if you do get it, even if you do have a positive gestational diabetes test in your pregnancy, as long as you can control it really effectively, your outcome is not going to be different. Outcomes are not different for people with well-controlled gestational diabetes than for people who do not have gestational diabetes. So if you're able to move, to eat a lot of protein, to take vitamin D, to do all these different things to kind of support your body to use the relatively higher glucose that you have, and you can keep your glucose values in a normal limit throughout your pregnancy, there's no additional risk to your pregnancy, and it does not inherently make your pregnancy high risk. So it's really worth it to do these things, these simple lifestyle things. It can take, of course, a little bit of a shift in terms of what your day-to-day plate looks like, what your day-to-day movement and activity looks like, but the payoffs are huge. You don't necessarily need to think about an induction of labor, of course, a big baby, which can be a complication of gestational diabetes, and some of the other kind of hard complications that can come up from unmanaged gestational diabetes. So these are the things we talk to all of our clients about in their pregnancy at Hearth and Home Midwifery, and we hope it's really supportive for you too.